Now we will be moving the two other conditions which are also tumor-like conditions. They also present with masses, but they are usually benign tumors. And we will be going through the enchondromatosis, that is intermediary osteochondromas, and fibrous dysplasia, which is also a rare condition but may mimic tumors as in other diseases. So we'll be going through in this section the enchondromatosis, its types, symptoms, and management. And lastly, we're going through the management of a disease called as fibrous dysplasia and its treatment. So what is enchondromatosis? Probably what would the name suggest? It includes chondro, which means something related to cartilage, and N means inside. So these are actually osteochondromas. These are growths inside the medullary cavity. This is a condition characterized by discrete islands of hyaline cartilage within the metaphyseal and diaphysis of the long bone. The important point over here is these are actually hyaline cartilaginous growths which are inside the medullary cavity. We usually present the metaphysis to diaphyseal regions of the body. Most commonly in the metaphysis of the long bones. For example, especially the femur, distal femur, as you can appreciate over here, these are involving the distal femur. Sometimes they may be present in the hand as well. The usually a sporadic condition. It has a familial tendency. If the children who are born to this, usually parents have a tendency of increased number of enchondromatosis as well. It's where, as we know, that the bone is actually formed through enchondral ossification, the long bone especially. And what actually happens is that there is a primary center of ossification which appears in the diaphysis, and the secondary ossification center which is present in the metaphysis. Now this secondary ossification center which has appeared, this actually results in formation of cartilage in the metaphysis. From then this cartilage is once formed, this is actually converted into normal bone. But usually in these cases, enchondromatosis results in actually there is unossified cartilage. That this mechanism is actually a failure, that once the cartilage is formed, the metaphysis from the secondary ossification center, this is not actually converted into bone, rather it remains there as hyaline cartilage, which is supposed to be the cartilage which should be present over the articular surface, not inside the medullary cavity. This results in a physeal damage and eventually shortening and angular deformity, because once they grow inside the bone, they may result in angulation of the joint, eventually producing angular deformities around the knee. Or as they are lytic lesions and the cartilage cannot withstand so much, this eventually sometimes leads to a pathological fracture, that even a minor trauma, because bone is weak, minor trauma results in a fracture of the distal femur. Symptoms, as I told you, usually there are multiple enchondromas may be present inside the medullary cavity, mainly of the metaphysis and diaphysis of the long bone, or sometimes they involve the hand as well, because these tubular bones, especially of the metacarpals, they and the pharynges, there may be multiple enchondrosis may be present in the hand as well. As this, if you see it over here, this is also a rare occasion, but they can be present over here in the ileum as well. There is always a chance of a malignant transformation, almost less than 1%, but almost 1% chance of these enchondromas developing into some kind of a sarcoma. Usually, if they are present in the multiple digits, they eventually are called as Olier's disease or Maffucci disease. Multiple enchondromatosis of hands is actually termed as Ollier disease. A multiple enchondromatosis of hand along with vascular hemangioma is termed as Maffucci syndrome. There are two different discrete patterns, but usually they have, as there's a cartilaginous tumors, though they have a tendency to develop into a chondrosarcoma. And the other skeletal manifestations may also be present, leading to bone pains, angular deformities, and maybe deformity of the hand because of the multiple enchondromatosis of the metacarpals. Diagnosis could be through the radiographs. We know there may be multiple ballooning of the lesions in the metacarpals of the bone. There may be associated intramedullary lesions in the metaphysis and diaphysis or long bones such as femur, and especially the distal femur. There may be radiolucent streaking which may be present on the x-rays. There may be no ossification of cartilaginous columns. There will be no calcification. Usually, why this is popcorn appearances, actually There may be, as their cartilaginous tumors, usually cartilaginous tumors have a spiculated or punctured appearance resembling a popcorn. But as there are multiple enchondromatosis may be purely lytic without any calcification, or they may be present with calcification leading to a popcorn-like appearance in the metaphyseal or diaphyseal areas. They may present with angular deformity, and usually bone expansion, the phalanges and metacarpals can be seen on the x-rays. Depending upon the treatment, if it's isolated, usually if that can be dealt with interlesional curettage and extensive curettage, and after using bone graft as well. And then if the whole cavity is actually removed, then it is filled with the bone graft so that the bone can be stabilized. But if it presents with angular deformities, it has advanced to a stage that it presents with angular deformities, then not only the intralesional curettage and the bone grafting may be necessary, then osteotomies of the bone may be also required to correct the angular deformities. Then if it presents with fracture, if a pathological fracture has occurred, then yes, we need to take out that first by intralesional curettage with high-speed burr. But yes, after we need to fix the pathological fracture as well, either with a conventional fixation. If, for example, if it presents with a distal femur fracture, then probably intramedullary static nailing would be ideal choice. So in case of pathological fractures which has occurred from multiple enchondromatosis, they may be augmented with grafting. Mostly there is bone graft is used, but sometimes the bone substitute such as calcium sulfate and phosphate can also be used. If and post excision sequelae, sometimes they what results in, because they are present in the metaphyseal, sometimes they can cause physeal damage, but during the surgery physeal damage can occur as well. Eventually in children, you later on in life, they may present with limb length discrepancy. So limb equalization surgery, which may be including limb lengthening or limb shortening, or epiphysealis may be required later on, so that the deformity of the limbs can be corrected. As I just told you, lengthening and growth modulation may be needed, debulking and local excision is required. Later on, now coming to another tumor-like condition called as fibrous dysplasia. It's a condition that affects bone development and involves replacement of the bone with the fibrous tissue. As the word suggests, it's actually dysplasia is actually maldevelopment, and this is that instead of normal development, it is replaced by fibrous tissue. It's an asymmetric usually lesion. Lesions are usually asymptomatic. The patient may not know them, but if he or she gets an X-ray of the leg for any other reason, then usually it's seen that it may be a lytic or a blastic lesion, mainly seen in the tibia. It could be monoostotic or polyostotic, which means usually a single lesion. Bubble-shaped lesion may be present in the tibia. There may be a multiple bubble-shaped lesion which may be present in the tibia. Then it's usually associated with sporadic mutation in the GNAS1 gene, which actually causes increased cyclic AMP stimulation, which causes excessive DNA synthesis, eventually leading to fibrous material synthesis and no normal mineralization. Eventually what results is that instead of maturation into a normal lamellar bone, this results into a fibrous bone. If you see it over here, as we know, this skull and face bones are usually and membranous or ossification is normally looking. If you see the CT, you can appreciate over here that this is a fibrous dysplasia. The bone is replaced by fibrous tissue. Although most common area of presentation is actually in the long bones, especially tibia. The clinical features include, it may result in limb deformity, fractures. There may be no associated non-specific bone pain, swelling, or tenderness. Usually there are two syndromes which are associated with fibrous dysplasia. One is called as McQueen-Elbrat syndrome, and another is a Mesobrot syndrome. Actually, McQueen-Elbrat syndrome is associated with polyostotic fibrous dysplasia, cafe-au-lait-like spots, and they're associated. And Mesobrot syndrome is actually polyostotic fibrous dysplasia associated with intramuscular myxomas. They are termed as Mesobrot syndrome. Proximal, most common is in proximal femur, then tibia, then pelvis, and then the foot as well, sometimes also frequently involved. Diagnosis is through the radiographs. If you see over here, it's lytic plus sclerotic bubbly-like lesion usually present in the metaphysis to diaphysis, which is usually classical fibrous dysplasia. It's usually well-defined intramedullary lesion and usually the most pathognomic is the ground glass appearance. Then it may be radiolucent, that is lytic, or sclerotic. If it is present in the proximal femur, this may result in deformity of femur called as Shepherd-Cook deformity, which is very classical of other deficiencies as well, such as osteogenesis imperfecta as well. But this, as this bone is actually replaced by fibrous tissue, so bone cannot carry out the weight of the body. As a result, over the period of time, this results in a bowing of the proximal femur, leading to a Shepherd-Cook deformity. If this is what patient presents with, the first and foremost is an open biopsy. Why? Because there is always a 1% chance of this developing into a fibrosarcoma, osteosarcoma, or even a chondrosarcoma. So once we are sure whether it's a biopsy that is not any of these three, that is either not a chondrosarcoma, osteosarcoma, or fibrosarcoma, mostly it's a benign disease. If it's a fibrous dysplasia, then the treatment is directed against fibrous dysplasia. Treatment includes the use of bisphosphonates, that is to relieve pain, and if it has presented by pathological fracture, then we have to do surgical stabilization with nail, or realignment osteotomies may be required if it is associated with angular deformities of the joint. Then the intralesional curettage and bone grafting is must to for the surgical resection of the fibrous dysplasia. In this section, we have gone through the disease called as multiple enchondromatosis and fibrous dysplasia. These are also one of the tumor-like conditions that they present with multiple bone lesions, which are usually intramedullary, and they're mainly seen in the metaphysis and diaphysis of the long bone, and may be present with associated in hand as well. We have gone through that there is may be associated with certain syndromes called as Ollier syndromes and Marfan syndromes. Then we have also gone through another tumor-like condition such as fibrous dysplasia, in which the normal bone is actually replaced by fibrous tissue, and it may be associated with certain syndromes such as McQueen-Albright syndrome and Mazabrod syndrome. Keep watching sqadia.com. Thank you very much.